and welcome to Let's Talk, a podcast series produced by Hazel and Betty Ford. I'm William C. Moyers, your host. My guest today is Dr. Sara Polley. Dr. Polley is the medical director of Hazel and Betty Ford's National Substance Use and Mental Health Treatment Center for Adolescents and Young Adults in suburban Minneapolis. She is board certified in adult psychiatry, child and adolescent psychiatry, and addiction medicine. She joined Hazel and Betty Ford earlier in 2021. Welcome, Dr. Polley.
Yeah, thanks for having me.
This pandemic has affected all of us, but it has probably had a particularly harsh effect on young people. How so?
Yeah, well, that's good that you bring that up because, part of the developmental task of a teenager and a young person is to sort of emerge from their family out into the world and figure out who they are. It's normal for young people at that age to have their friendships and their opinions of the people out in the world to be more important than the opinions of the people that are in their house. And it's not always like that. It kind of comes back around when people get older. And so, I think what the pandemic has done is it has taken away the opportunity for a lot of teens and young adults to be out in the world, to have in-person interactions with their friends, with other adults, to really be able to explore who they are outside of their home. And so I think, the result of that is that we're seeing a lot of kids struggling with mental health difficulties, a lot of family conflict, things that I think you could expect having had that sort of developmental task be sort of stunted or delayed, kind of keeping kids in the home when really their main goal and drive at that point is to not be in the home and not kind of be with their families.
What about wearing masks? I mean, it's a controversial issue. We're not going to discuss the pros and cons because we know that masks are a good deterrent. But the fact of the matter is that wearing a mask it blocks our ability to communicate with each other. How does wearing masks affect young people?
Yeah, that's a good question. I think it's actually interesting. So generally speaking, a person when they're communicating uses the eyes much more than they use the mouth, which I always found that to be so interesting because they're actually finding that even in young kids that struggle with communication and verbal abilities, they're not actually as far behind as we thought they might be watching people in masks talk because we actually use the eyes so much more than we use the mouth when we're talking. And so you can hear my voice and you notice as we're talking, right, we're making eye contact with each other. We're not looking at each other's mouths. So it's actually, what I see happen more is that, I think teens and young people are frustrated by all of these new stipulations and rules that have to do with the pandemic. And, not only is that society, teachers, schools coming up with these rules, but then it's parents. And parents all have different levels of comfort with the pandemic, right? And so some are going to have a lot more rules or regulations for a child than others might. And I think teens hate that inconsistency. Well, my friend's dad says that he can go to the movies. Why can't I go to the movies?
Yes.
And so I think that comes out with mask wearing too, because it's on your face, it's something you can control. And so I see a lot of teens who, will be wearing the mask all funky down, and you kind of laugh about it and you're like, what are you doing? Why are you wearing your mask that way? And I think honestly, it's an expression of how crappy they feel about this whole situation. And it's like, I can't do what I want to do with anything else. I'm going to wear my mask the way I want to. But it's very sweet, actually. Usually I'm just like, well, come on, I want to wear mine. I want you to be safe. And the majority of kids, I think, will be like, oh, okay, and put it in the way it's supposed to be. But
can we talk a little bit about the mental health implications of being a young person in this pandemic, post-pandemic world?
Yeah, well, I think there's a couple of things that we're seeing. I think kids that have underlying mental health difficulties are seeing an exacerbation in those symptoms during these pandemic times. And I think the reason for that is increase in general family stress. We know that the majority of mental illnesses for a person do better when they're in kind of a lower chaos, lower conflict environment. And for a lot of families, this pandemic has been amazingly stressful. Financial hardships, physical health concerns, worries about physical health of family members, sometimes loss of family members from COVID or other illnesses that weren't managed. And so, I think we're seeing a lot of exacerbation of underlying conditions for kids. I think kids who may have been wouldn't have had a diagnosable anxiety disorder or a diagnosable depression have now, because of the added stress, sort of moved from maybe being like sub-threshold, what we would say, or at risk, to being now having a diagnosis. And I think people weren't accessing treatment as much as they were previous to the pandemic initially. I'm hoping now that that's changing a little bit with access to televideo services, which have been, a lot of places have gotten those online really quickly for people with the pandemic for mental health treatment. But there were periods of time there where people stopped taking their medicine, they stopped seeing their therapist, and I think that caused worsening. So I think we're seeing a lot of struggles coming from young people and from families in general with the pandemic.
Let's talk about substance use issues.
Yeah.
I mean, on the one hand, with people being confined or young people being confined for as long as they have been and not interacting like they were, you would like to think that maybe they don't have access to substances like they did before, but that's not true, right?
Yeah, well, and I think initially at the very beginning of the pandemic, I think that's what we saw. And I saw that clinically too. I mean, I had patients who, because of everything kind of going into lockdown, I mean, we saw this with nicotine use too, is that right? Like the convenience stores and the cigarette shops were closed. And so people couldn't go and get their cigarettes. And so then they would not be smoking quite as much, or they'd be trying to save the ones that they had and kind of tapering them down. But pretty soon after the beginning of the pandemic, I think that effect stopped, and then people went back to either their previous levels of use or, I think, and the data for this is still just coming out,
right.
But I think that what we were seeing was that people who were already using substances saw worsening of their substance use in the same way that people who already had depression or anxiety saw worsening of that. I don't think that there were, and this is reassuring, I think that people who were not previously substance users didn't, all of a sudden start to become substance users, but those that already had a pre-existing struggle with that, it was exacerbated.
What should parents be looking for with their young daughters or young sons?
Yeah, well, so, I always tell the parents that I work with this is that they know their child much better than any professional or teacher is going to know their child. And so I think, some parents will have an instinct, right? Like something's different about my kid. And they might not know exactly what that is. They might think, well, are they depressed? Are they anxious? They're not interested in the same activities they used to be interested in. They used to love, fashion design, and now they don't care. Their sleeping habits are all over the place. They didn't used to be a kid that was up at 3 a.m. outside of the house for some reason, and now all of a sudden they are. So I think unusual behavioral changes in your child is really kind of one of the first things you'll see. Academic decline now that once we're getting back to school, I think kids that previously were good students that now don't seem to care or just are not getting the kind of grades they used to. I think that's something else to take a look out for. And I think, keeping an eye on your kids' social media is also really important. And I know a lot of kids don't want their parents to keep an eye on their social media, but I think that oftentimes kids, you'll see things on social media that are sort of like, what is that? Why is my kid in that picture with these other kids that are doing these things? And that can just be a place that you could use that as a starting point to talk with your child. Like, look, I saw this on Instagram or wherever your child is on social media, and say, can we just talk about that? What was happening?
Parents do have a responsibility to monitor their children's social media presence, yes?
Yes. Yes, 150% agree with that. And I think that it's hard, it's challenging, right? Because of course, your young person does not want you as a parent to do that. And so I think it's a struggle as a parent to balance what you need to do as a parent and what your kid kind of wants you to do, and you don't want to kind of have that conflict. And so I think that, it's easy to kind of avoid it or not do it. But yes, I agree with you. I think social media is such a challenge. I know this is not about social media, but social media is such a challenge for young people to navigate.
So what role do they play in, I don't want to say monitoring, but observing the well-being or the lack of well-being with young people who are coming back to school?
Yeah, well, so I think what I'm thinking we'll see happen is that there'll be a chunk of kids, right, who go back to school and they just do fabulously. They're excited to be back. They've been looking forward to this. They start to achieve at the same levels that they were always achieving. Maybe they struggled more during the pandemic because they couldn't stay on task or they weren't super committed to the work when it was distance. But now that they're back, everything's great. And then I think we're going to see a chunk of kids where maybe previously they had always sort of been great at school and really excelled. And then now when they're coming back, they're maybe just not quite the same kid. And so to me, that would be a place where parents may need teachers to reach out to them or to staff at the school to say, I'm worried about your kid. Your kid is previously honor roll, really interested in doing theater, on chess team, and now they don't seem to really be interested, or, they seem to have really shifted friend groups. I don't see them with the same kind of kids they were with before, because parents may not necessarily be aware of that, and this might actually be the first time this is kind of out in the open in the community. So I think teachers and staff at schools could really serve a good role in, notifying parents if there are differences or things that they're seeing, or if kids just aren't showing up for school, right? Because that's a concern I think that I have too, is that, and every year we get kids in treatment who fail to go to school, right? Because of either mental health or substance use, they just don't show up. And then the district gets involved with, is your kid truant? What is happening here? And so I'm thinking, we may unfortunately see groups of kids who just don't show up for school again in the fall. And so for schools to take note of that and reach out to families to see if there is something happening, and then getting kids connected with care and help if that's what they need.
We only have about 5 minutes left. We could go on for another hour. Your knowledge and your perspective are invigorating and insightful. But in the few minutes that we have left, let's talk a little bit about what we were discussing off camera, which before we recorded, which is what appears to be the reluctance of parents to address their young person's substance use or mental illness. Mm-hmm. What is your message to parents who have children that have been struggling or will be struggling in the times ahead?
Yeah, well, so I think my message is that, I hope and I wish for your child that at the end of this pandemic, whatever that means, right, your child going back to school, that things for them will go back to normal. But there's a good chance that they won't go back to normal, and that your child may still struggle. And so, not to avoid seeking care for your child with the hopes that you're overwhelmed and there's a lot to do and maybe it'll just be fine, but really, not letting something bad happen and really getting your child connected with care. And whatever care seems reasonable for your family, right? Like if you're at a stage where, the idea of your child going to a residential treatment is too much. Like I don't know how to pay for that. That seems overwhelming. Even just reaching out to a therapist, getting them connected with outpatient supports. I mean, professionals are all wanting to help kids during these times and are also very good at assessing risk and need for different levels of care. And so if you get your child involved with an outpatient therapist and they're still struggling and it's not working, then they can help connect you with the type of care that might be a better fit for your family. But just making that first step and reaching out is so important.
And your point to me earlier was that it's easier to make that first step now because we have telehealth.
Yes, and it's funny too, actually, with young people, I think have really taken up the televideo platform a lot easier. I do have patients who say there's something about the in-person connection where I take this more seriously and I'm more honest with you. And at the same time, I have kids that, I've had fun. I've got to see teens' bedrooms with their posters and their art project that they were doing and meet their cat. And I think a lot of them are very used to being connected and open on a televideo platform just from social media with their friends that, a lot of them don't blink an eye and they, it's kind of fun to get to have a window into their life.
How has, before we wrap it up, how have you had to approach your responsibilities, your job differently given this pandemic? I mean, you're down in the trenches at Hazel and Betty Ford's adolescent site in suburban Minneapolis. And we've got patients there every day who are struggling with a substance use disorder or mental health problem or both. How have you had to adjust your approach to helping young people?
Yeah. Well, I've definitely found myself, embracing more of the medical side of my training in addition to the psychiatric side, meaning that I do a lot of education with kids about the vaccine, about the importance of masking, hand washing. Actually just recently was part of community groups on our units answering questions people had about COVID, which I like doing that. It's fun. But generally as a psychiatrist, I don't have a day-to-day role in talking about an infectious disease. And so but a lot of times I'm the most accessible doctor for a lot of my patients. And so of course I want to provide them with the knowledge and the education so that they can make healthy choices for themselves about whether or not to get the vaccine and how to take care of themselves during this time.
Mm-hmm. And you are a psychiatrist with a focus on young people. And these are tough times, but surely you must have a lot of hope for young people. And I know there'll be some young people who tune in to watch this because they want to know more about this topic. What's your message to young people?
Yeah, well, no, I mean, young people are amazingly resilient.
Yes.
Their brains are so capable of change that, people can make dramatic and drastic life shifts if they put their mind to it and they want to. And so, being a young person that's struggling, I mean, now is the time to really reach out and get support and help, because you have the opportunity to have this all be in your past and kind of have whatever kind of adult life you want to have for yourself. And so, being a young person is an amazing time of hope, even with the stress that's going on now,
Well, thank you for that message of hope, and thanks for bringing your expertise, your passion, and your commitment to people, young people and their families who need and deserve help. Thank you, Dr. Sara Polley.
Yeah, thank you.
And thanks to all of you for joining us. Remember, addiction to alcohol and other drugs doesn't discriminate. Treatment works. Recovery happens. So don't wait if you or a loved one in your family needs help. Ask for help and do it now. I'm your host, William C. Moyers. I hope you'll plan to join us again for another edition of Let's Talk. See you soon.